Welcome to a presentation on interstitial lung disease brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Interstitial lung disease is like a house with a leaky roof. The roof of the house is like the alveoli in your lungs, which are responsible for exchanging oxygen and carbon dioxide. When these alveoli become damaged, it's like having a leaky roof. Air can escape from the house, but it can't get back in. This means that your lungs can't exchange oxygen and carbon dioxide properly, leading to difficulty breathing and other symptoms of interstitial lung disease. Interstitial lung disease, ILD, is a group of lung conditions that cause scarring of the lungs. Symptoms of ILD can vary depending on the type and severity of the condition, but some common symptoms include shortness of breath, especially during physical activity, a dry cough that does not produce mucus, fatigue, weight loss, chest pain or tightness, wheezing or crackling sounds when breathing in deeply, bluish discoloration of the skin due to lack of oxygen, cyanosis. If you experience any of these symptoms, it is important to speak with your doctor as soon as possible. Early diagnosis and treatment can help slow the progression of ILD and improve your quality of life. Interstitial lung disease, ILD, is a group of diseases that affect the lungs. It can affect people of any age, gender, or race. However, certain types of ILD are more common in certain populations. For example, idiopathic pulmonary fibrosis, IPF, is more common in men over the age of 50. Sarcoidosis is more common in African Americans and Asians. Asbestosis is more common in people who have been exposed to asbestos fibers. Finally, hypersensitivity pneumonitis is more common in people who work with animals or have been exposed to certain molds or chemicals. Interstitial lung disease is a group of lung conditions that cause scarring of the lungs. The exact cause of interstitial lung disease is often unknown, but there are some known risk factors that can increase your chances of developing it. These include smoking. Smoking is the most common risk factor for interstitial lung disease. It can damage the air sacs in your lungs and lead to scarring. Exposure to certain substances. Exposure to certain substances such as asbestos, silica, and coal dust can increase your risk of developing interstitial lung disease. Genetic factors. Certain genetic conditions can increase your risk of developing interstitial lung disease, such as alpha-1 antitrypsin deficiency and telomere biology disorders. Autoimmune diseases. Autoimmune diseases, such as rheumatoid arthritis and systemic lupus erythematosus, can also increase your risk of developing interstitial lung disease. Infections. Certain infections, such as tuberculosis or fungal infections, can also lead to interstitial lung disease. Treatment for interstitial lung disease depends on the underlying cause. In some cases, medications may be prescribed to reduce inflammation or suppress the immune system. In other cases, supplemental oxygen may be necessary to help with breathing. Surgery may also be an option in some cases. In addition to medical treatments, lifestyle changes can also help manage interstitial lung disease. Quitting smoking is essential for anyone with this condition, as smoking can worsen symptoms and make it harder to treat. Exercise can also help improve breathing and overall health. It is important to talk to your doctor about an exercise plan that is safe and appropriate for your condition. Finally, it is important to follow up with your doctor regularly so that any changes in your condition can be monitored and treated promptly. The prognosis of interstitial lung disease depends on the type and severity of the condition. In general, mild cases may improve with treatment, while more severe cases may require lifelong management. Some types of interstitial lung disease can be fatal if left untreated. It is important to follow your doctor's instructions and take all prescribed medications to help manage your condition. Additionally, lifestyle changes such as quitting smoking and avoiding exposure to environmental pollutants can help improve your prognosis. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinali.com/info. Be safe. Love you.